So what inspired me to start the gccg? This is of course the group effort. So this is not an idea that arose from one single person. The motivation to think in that way is that we trying to get a uniform approach worldwide for various clinical indications, and more importantly, an approach that is really usable in day-to-day clinical practice. Sometimes it's really hard to translate pure science into clinical application because it becomes too broad, it becomes too much into detail, and this is what we want to achieve. Rather flat, straightforward but evidence-based approach that can be applied worldwide for the sake of our patient. The unique methodological approach is actually that we start from a different perspective. We start to ask clinicians, experts working in practices, working in university settings, what they are actually doing. In this case, we are targeting the edentulous maxilla. So how do you plan a case? How do you select the patient? How do you plan? How do you treat? And how do you maintain such a case in your office? And this might not necessarily be in line with the latest evidence, but it's established clinical practice. And from there on, we started to evaluate these procedures based on the current evidence, and we try to come up with recommendations that can be applied in each and every setting. So we have chosen the edentulous maxilla because this is the most demanding and the most complex situation that you can in fact face in day-to-day practice. On the other hand, this is also an indication that is quite frequent, depending of course on the country where you live, and that's why this has been, without any discussion, the target for our first gccg. So my personal motivation is quite simple. I'm in this area of dentistry, of oral surgery since 25 years. You have met many colleagues and friends along your way, and you have built up a network, a connection with people all around the globe. So this is of course the starting point where you can contribute. I want to give back something to the community, and what I personally want to see is that we collectively use these guidelines for the sake of our patients. So this is my personal motivation.